Good afternoon, this is Dr. McDaniel at GYN Corner. Happy Independence Day. It's July 4th, and I think you'll be hearing some firecrackers periodically because there's people, I don't know what they're doing, firecrackers and shooting things in the neighborhood. So I got a few messages, Facebook messages about what was going on, why I had the broken shoulder and such. So I'll go ahead and present that. Not today because I just want to finish the cervical cancer things, but I'll present that probably next week. Maybe if I see the orthopedic doctor, I'll present it if I see the orthopedic doctor. I'm still debating on whether I'm going to see the orthopedic surgeon or if it's going to be potentially a waste of time. So if I do, I'll wait till after I see them, and then I'll give the spiel on how I got injured on my trip and why I have a broken shoulder and a torn ripped hamstring. But yesterday I spoke about cervical precancer, the early or what we call mild dysplasia, low-grade SIL, squamous intraepithelial lesion. I spoke about that and the treatment option, which is cryoablation, cryosurgery. It's a freezing procedure to exfoliate the cervical skin. When you exfoliate the cervical skin with the freezing procedure, fresh, normal cervical tissue regenerates in its wake. It's similar to people who have the age spots, liver spots, freckles, and they get a chemical peel. You're simply removing the outer skin layer and then allowing it to heal. It'll be normal when it heals. Won't have the changes. So that's an option for early or mild, low-grade precancerous changes of the cervix after it's been diagnosed with a colposcopy. And the studies have shown that approximately 80 to 85% of women 2 years following that diagnosis and procedure will still be normal. The studies also showed that if women do absolutely nothing but literally let time heal all wounds, approximately 65% of women are also normal by just allowing the bodies to repair on its own. 65% of women are also normal at the end of that 2-year time frame. So it used to be that we told everyone they absolutely need to do a treatment in order to prevent the progression from low-grade or mild changes to high-grade or severe precancer and ultimately cancer, but it turns out not to be the case, that a large chunk or the majority of women with that diagnosis will normalize on their own. And it makes sense because if someone has the virus does not constantly actively replicate. They're not constantly contagious for HPV. It's not constantly active and causing skin or cell changes. The HPV goes in and out of activity. Because it goes, technical difficulties. It goes in and out of activities. I thought my mic was connected. It wasn't. Because it goes in and out of activity, there will be periods of time where the HPV is not active. If it's not active, it can't cause problems. It can't cause precancerous changes. We don't have medication to prevent cervical precancer changes, but we do know that the immune system can prevent HPV cervical precancer changes, because HPV is what we call an opportunistic infection. So it takes advantage of a compromised or weakened immune system. If the immune system is strong, the immune system can suppress the virus, and if the virus is suppressed, we can't pick it up on cultures. The culture for the HPV will be negative, and if it's suppressed, it can't cause precancerous changes. It can't affect the cervical tissue. Any supplement that helps boost or strengthen the immune system will help suppress the virus if someone has HPV. I'm going to say the best one or the strongest one to help the immune system, in my experience with patients over almost 30 years, is L-lysine. It's an amino acid, and I always recommend 500 milligrams in the morning, 500 milligrams of lysine in the evening. take it religiously, like your life depends on it, and it will help support the immune system, and it will suppress the viral activity. If the virus is suppressed, it can't cause issues. You're in the same boat as people who don't have the virus at all. And of course, all of the cells in the human body exfoliate, regenerate naturally on their own, including your eyeballs, your tongue, mouth, intestines, and that includes the cervix. So given time, the cervical cells will exfoliate and regenerate on their own, and if the virus is inactive, it can't cause problems when those fresh new cervical cells regenerate. So it makes sense that 65% of the time, if people don't do the treatment anyways, they will still normalize because the cells exfoliate and the virus is inactive for a bulk of that time period for most people. So I always tell people that HPV is similar to herpes. People who have cold sores, herpes 1 or genital herpes type 2, they're not constantly actively frequently having outbreaks and being contagious. It depends on their immune system. So a lot of people know if they're stressed out or they have a lot going on, then they will get a cold sore or they'll get a herpes outbreak. So it's the same way with the HPV. They're very similar viral infections. They're both opportunistic infections, and they take advantage of a weakened or compromised immune system. So I'm going to stop there. I hope everyone could hear the beginning of the presentation. I didn't realize that my mic was not plugged in. So today is Thursday. It's 4th of July. Happy 4th of July. Happy Independence Day to all the Americans. This is Dr. McDaniel at GYN Corner. Short and sweet today. Tomorrow I'll go into how we address not mild or low-grade changes or precancerous issues, but how we address severe or high-grade precancerous changes of the cervix. Thank you for watching. Check out the YouTube channel. It's also called GYN Corner. And please, please, please like, subscribe, and comment. Thank you.